Yes, I can hear you.
Say something again.
Hello, I can hear you.
Okay, all right then. I can
Okay,
hear you.
right.
All right, so just 1 minute.
Would I need to be on video necessarily?
Yes, because it's streaming live to YouTube right now.
Okay.
All right, we're coming in soon.
8:05. That's Lipton tea time. It's time for a cup of Lipton Extra Strong.
Okay, are you set?
Yes, I am, I think.
98.1. Love music, love life, smooth 98.1. You're welcome and thank you so much for joining us. Right now, it's the Soul Food Conversation. It's all about your health and your wellness. And yes, thank you again for staying tuned. This is Breakfast in Bed, the show that takes you from 7 a.m. till 10 a.m. every Saturday morning. My name is Oluwaseun. And if you're following us across all social media platforms, you should have gotten the notification that we did put something up towards the conversation this morning, talking about asthma, the myths and the fact. I am joined by my special guest this morning, and he is the co-founder and CEO of New Childcare. His name is Dr. Yusuf Shittu. Good morning.
Good morning, good morning. Thank you so much for having me.
I'm glad I got to wake you up this morning.
Thank you.
Thank you.
Joining in from Leicester in the UK. I work as a general practitioner in training.
Wow. What was the time there now?
Yes, just 7 o'clock in the morning. Yeah.
Yeah. Sorry, I had to disturb your sleep. I hope you didn't have too much of a rough week.
It was rough, but we moved still. Thank you.
Yeah, that's Nigerian spirit. Thank you again for joining me for this conversation. Now, let's go quickly into it because we do not have much time. Now, asthma. Whenever we hear it, the only thing or the first thing that hits a number of people's mind is that condition that takes your breath away. Literally, when they say it in the Nigerian parlance that it choke, that's asthma. That's what comes to our mind. But then, from the medical point of view, in the layest way possible, what is asthma?
Right. So, in the layest way possible, asthma is a common condition affecting the airways, causing reversible obstruction. So the best way I like to describe it is if you think of a pipe, and if you think of your airways as a pipe like this, right? And if anything literally causes your airways to react to allergens, stimulus, whatever, anything in the environment, stress that causes the airways to narrow, right? So if air was able to go in easily, with this very wide airway, right? When it narrows, it makes it difficult for people to breathe. So that's the best way I can describe asthma. And oftentimes it's a chronic condition, so it doesn't just happen once; it happens over time.
Okay. Now, if you're wondering why we're talking about this condition, considering the fact that it looks like a number of people have it around and they seem to be fine, I'll give you a quick data. According to the World Health Organization, asthma is said to be the most common chronic disease among children worldwide, with around 235 million people living with asthma. Now, that's not all. It's said that this disease is more common in children than adults, but then the adults are 4 times more likely to die from asthma than children, which I find very intriguing because I thought it should be the other way around, considering the fact that children do not have much help. And then again, it says that over 80% of asthma related deaths occur in low and lower middle income countries. And it is said, no brainer, that the prevalence of asthma in Nigeria is high with approximately 13 million cases, which ranks amongst the highest in Africa. Now that I've laid down all the data, just a quick pause. I'll be back to take your thoughts. And of course, we go further into asthma, what it is, how it comes on, and what you can do about it. If you want to join this conversation, you're free to. Please send your messages in to 0809 4440981, and then the calls come into 0144899821. As it is with us here, we're streaming live on YouTube, so you can go to our YouTube channel now to check us out. Yes, and of course, drop your messages in the chat box option.
Fly, silky smooth, 98.1.
Just an ad break for a minute or two.
All right.
Moms and grandmas, thank you for nourishing a generation of strong and smart kids with breakfast plus Big 456 growing up milk fortified PHA. Happy Mother's Day.
Grow up strong and smart with Peak 456 growing up milk every day.
At Jumia, we know tech is a part of your everyday. It's how you connect, transact, and get things done. It's always been a part of your lives and ours, making us all better. Which is why it's so exciting to know that the tech sale of the year is back. Jumia Tech Week sale offers you phones, laptops, gadgets, and electronics at lower prices from the 21st of March to the 3rd of April. And you can enjoy free delivery in Lagos and Abuja of thousands of orders above 4,999 naira. Don't miss it. Jumia, your everyday delivered.
What can you say about your finances? Let's talk about it, shall we?
What can I say about money?
People don't really like to talk about money, or do they?
It's extremely complicated.
I think everyone worries about not having money and being broke.
We make money, we spend money.
Poor people complain about money, while the rich discuss money.
It's a rich man's world. Well, for me, my dad invested in businesses, and that's how I started to learn about money.
And as you enter into the workforce, it really becomes you versus the economy.
Then you realize there's little or no money to save, even though you worked hard for it.
So that's why every kobo you earn needs to be stretched as far as it can go.
But
sadly,
nowadays, we no longer spend in kobo.
especially when it comes to matching up against the dollar.
Now let's discuss your finances and simplify its principles for you. Tune in to Personal Finance.
If you know or you're interested in knowing how to increase your portfolio and of course earn in dollars all the time, like Rutu says, you should tune in and join him every Wednesday, 5:15 p.m. on the Smooth Drive. And of course, you listen to Rutu's and his informed and hot takes. Right now, you're tuning to Breakfast in Bed. It's the soul food segment. We're talking about asthma, the myths and the facts. We're streaming live on YouTube too, so you can go right now to check it. Share the link with somebody who should be a part of this conversation. Take it a step further and send your messages, your questions, whatever it is, your thoughts, opinions to 0809-444-0981. And then you can call on the number 01-448-9981. You can also drop your messages in the chat box on YouTube. My guest is Dr. Yusuf Shittu. He's the co-founder and the CEO of New Childcare, joining me all the way from Leicester. Thank you again. It's a pleasure having you. Now, before we took that short breather, we were talking about the fact over 80% of asthma-related death occurring in low and lower middle-income countries. Nigeria being on top of the list when it concerns the prevalence in Africa, which is
always on top of the list, unfortunately.
I mean, it is estimated that we are close to 200 million. So with that kind of population, it's just expected I would be taking a number of things, both the good and the bad. So now back to it. So you have given us the information about what asthma is, explaining how it, no, you've not explained how it sets on. So let us know that. What are the causes of asthma?
Right. So basically, asthma is caused by an inflammation of the airways, and what that means is a swelling of the airways. Anything that irritates the airways and causes the airways to produce more mucus, and in effect also narrow the airways. Right. It is often it tends to run in families, so there's also the genetic predisposition. Unfortunately, right?
Wow.
All right, and there are several, risk factors that would predispose someone to getting asthma. Some of which would include infections, right? So those people that commonly have catarrh every now and then, recurrent so-called rhinitis. They're always having cough and catarrh recurrently every now and again. There's always that, there's that predisposition that it might lead on, eventually to a more chronic condition like asthma.
Wow.
Exposure to various type of allergens. It could be dust, it could be, pollen, it could be, anything that literally irritates the airways, anything that would likely cause you to sneeze multiple times, right? It could be smoke from in your house. It could be, it could be grass for some people. All right. Aside that as well, exercise. Some people might not also tolerate exercise as well. So exercise can often be a trigger for asthma attacks, and some people, exercise is the only trigger for them, right? So they're otherwise always fine, except when they possibly take your run or something, right?
Okay.
So those are the common triggers, and interestingly, even emotions can trigger asthma attacks.
Emotions.
Right? Yeah. Yes.
Oh wow. So somebody is to say, for instance, a lady or a man just got heartbroken, they can have an asthma attack.
There's oh yes. Yes. Yes.
Okay, before we go to that, you were saying something about the triggers, the rhinitis and constant cough and cold, right?
Yeah.
But I am curious, what is the difference between asthma and a typical allergic reaction? Not in terms of food now, but in terms of the respiratory, let's just say respiratory
allergies. Yes. Yeah. So some people get what may be termed as a fever or general allergic reactions, especially from exposure to stimulus or anything offensive, and it's just a natural reaction, right? For you to, and it's even safe for your body to be able to react to anything that's unusual or dangerous and be able to expel it, right? But then in the case of asthma, it is a progressive condition. It is chronic in that you keep getting unusually severe reactions to those offensive stimulus. And that obviously is what predisposes your airway to more and more narrowing, that takes your breath away eventually.
Takes your breath away is supposed to be something lovely, but in this case, it's not. Let's try to analyze how this thing happens, how something that is beautiful, say pollen, for instance, you want to smell flower and all of a sudden it becomes something that triggers a reaction that can be life-threatening. How does it happen? Especially it is said that is more common in children than adults. Now let's deal with the children first, considering the fact that you are very much in that field. Yeah. How does this thing happen? A child is born into the world and they just say, you know what, I will not like the smell of akara, for instance. Anytime I smell akara, I start to I feel as if I'm being asphyxiated and all of that. So how does it happen?
So the best way to describe it, I think, and in a way that people would understand is, think of your airways as having soldiers that are just ready to respond to any offensive stimulus, right? And just the same way, and I think this explains why COVID was quite deadly as well, in that the airways are quite peculiar in that it connects a lot with our immune system, right? So any stimulus or any offensive stimulus or any trigger, any pollen, dust, whatever that comes in contact with the airway generates or stimulates an immune response, right? And by that, it means that the chest or the lungs the airways are ready, to fight any battle if they see anything unusual. So imagine that response being exaggerated. So for a simple pollen, imagine 1,000 soldiers come to fight just one battle, a battle with one person. So that in effect creates this excessive generation of mucus, and generally what predisposes people is our genetic makeup. And sometimes, aside our genetic makeup, is also our environment. So you being constantly exposed to something, eventually you become it creates an unusual result at the end of the day.
I thought it was supposed to be the other way around. That when you consistently expose yourself to something, your body just recognizes it as a normal thing.
Yeah. So the way immune responses, and that's exactly the way immunity is supposed to work, right? But in this case, it is abnormal, right? It is unusual and it is exaggerated, and that's what makes asthma different.
That's sad. All right, then. So we have talked about that in children. For adults, so it happens to that one day an adult wakes up and the body system decides, okay, I want in Nigeria balance, I want to overdo. My immune system say, I want to get so hyper. I want to go on the errand that was not sent, right?
Yeah,
That's just what happens. The body being overly defensive.
Exactly. So it often, in many cases, people wonder, why is it that okay, all through my childhood I didn't have any asthma attack or whatever, and all of a sudden, after the especially in the adolescent period, or when you're crossing over to younger adulthood, you just start to develop the symptoms. But what people don't often say is that many more often than not, they've had previous smaller allergic reactions whilst they're small, whilst they were younger. They've possibly got eczema at some point. They have unusual reactions, although mild. And because asthma does affect people in different levels of severity, right? So it is more common in children, because obviously the immune system is just getting formed, getting more mature. But then constant exposure to those allergens can tend to predispose them to asthma in later in life, and that's why we're not usually quick to diagnose asthma in children, because it's a chronic condition, right? You don't just see that a child was having problems breathing now and then you diagnose asthma. It's a sort of chronic condition. It's a chronic condition that you have to monitor a child over time to be able to arrive at that diagnosis.
Wow. So we can infer that in adults, the case of asthma, onset of asthma, is like a case of there is no smoke without fire.
Yeah, more often than not, yes.
Okay, that's very cool. Well, no, not cool. I mean, in terms of the explanation, cool. Yeah. So now let's go to why we have more deaths in the adults compared to the children. What are the possible reasons? Because first of all, let's talk about the factors that can determine the severity of an asthma attack.
Right. So I think there are two questions. So the first thing, it's largely unclear, right? But then there's certain things that might help us make sense of that data. And I think more often than not, asthma can be misdiagnosed or underdiagnosed in adults, right? So it can be mistaken for something else, a chest infection, whatnot. They might not get on treatment quickly, especially when it develops in adulthood. Another thing would be adults have the predisposition to are more likely to downplay it, especially if it's mild, till they get that severe asthma attack that can claim their lives. But in children, everybody wants to respond to that child that is having problems breathing. Everybody just wants to get them to the hospital as soon as possible. So those are the things that possibly explain why the data says so. And obviously, okay, the next question would be
what determines the severity of asthma attack?
Yeah. So there are a couple of things, and more often than not, it would be the exposure to the type of allergen, and how much of that allergen were you exposed to? Did you find, are you the type that responds adversely to smoke, for instance, and you just found yourself in the kitchen where your mom was just making soup and with palm oil and all of that, and smoke was all over the place. So the severity or the quantity of that exposure can actually trigger or make the attack quite severe. And also response. So how fast did you respond to it? How did you take steps to eliminate that that stimulus, or get away from the place, or find help? Because it tends to get worse and worse, because the more as soon as you're exposed, if you do not get help, it can progressively worsen.
Okay, thank you so much for the clarification. Another quick breather. When we come back, we talk more about the things, when somebody's having an asthma attack, what are the things, aside that shortness of breath, what are the things associated with it, so that somebody does not die? Because I'm trying to get that from what you were explaining about the adults, why they tend to die. Because, the kids, everybody is just rushing to their aid. See why people don't want to grow up, because everybody takes care of the children. But now the adults, they have to take care of themselves.
Take care of yourself, literally.
Well, yes, we'll be back.
Are your music station?
I would say we don't want to grow up now. They say grow up, grow up. We don't want to grow up. Let them take care of us. What's that?
Growing adulthood is a scam.
It is overrated.
Yeah.
But yeah, we're thankful still.
And I just wanna say thank you for standing beside me all the way. I just want to say that you we are here today. Today, because of you, you are me. Africa's gateway to the world. Access more than banking.
Dear smart moms and grandmas, thank you for nourishing a generation of strong and smart kids with breakfast plus Big 456 growing up milk, fortified with DHA. Happy Mother's Day.
Grow up strong and smart with Peak 456 growing up milk every day.
Okay, we're coming back in.
This is Rotis.
And this is Oluwaseun, and you're listening to Soul 981. This is Breakfast in Bed, and it's all about your wellness right now. My guest is Dr. Yusuf Shittu, joining me via Zoom all the way from Leicester, and we are talking about asthma. He's the co-founder and the CEO of New Childcare. Before that break, we were digging into why the adults tend to die from an asthma attack compared to the children. So aside that choking presentation, when somebody looks like, I am running out of breath, what are the other ways you can quickly figure out that this is an asthma attack?
Right. So in the case of an asthma attack, it is usually quite a severe episode of asthma, right? So we tend to call it an acute exacerbation of asthma, in that asthma on its own, might not present with any severe symptoms, especially when it is well controlled. But in the case of an asthma attack, you find the person literally out of breath, so struggling to breathe, having difficulty breathing. Aside that, you find that one of the things that we tend to do, especially in general practice, when we're trying to determine, even if it's over a phone call or a telephone consultation, is this person able to complete their sentences? Imagine you being out of breath, so much so that you're not able to finish what you're saying. You're literally, you can only say possibly one word at a time, right? So then it's very severe, right? So the person might be coughing repeatedly, might feel this tightness in the chest, that feels like they're literally being suffocated, right? So those are things that if anyone around you is experiencing, they need to get to the emergency of the hospital as soon as possible. It's not the thing, even if it happens in the dead of the night, it definitely needs attending to as soon as possible. More often than not, people that present with an asthma attack already have a sort of diagnosis or indication most of the time. So it would be a good idea also to ask them if they've got their inhalers with them, because that can actually be a life-saving intervention if they are able to use it.
Before we go to that inhaler, because it's one thing I have always wanted to know how it works, but before we go to that one, if unattended to, under how many minutes or seconds can a person die?
It is difficult to determine, and it definitely depends on the severity of the asthma attack. It is different from person to person, right? But then if there are drops in the the oxygen levels in the blood up to a certain point, at a point when it starts to affect the organs, the important organs of the body, the brain, liver, kidneys, the heart, if they're not getting enough blood oxygen supply, obviously it would be quite life-threatening. And it can be from minutes to hours if the person doesn't get help. So it can be quite an emergency situation.
Do you ever outgrow asthma, or is something you just live with for the rest of your life?
So in many cases it is lifelong, right? So it is actually something that you would likely have as a label for the rest of your life, right, as a diagnosis. But then you can have it under control for a very, very long time, right? So that's why we emphasize, aside being reactive, for patients to be more proactive about how they go about dealing with asthma, right? Moving from using less of the short-term medications or acute medications to actually using medications that put their asthma under control, because there are people that go many years without ever having an asthma attack. And that's because they know exactly their triggers. They know they're regular with their medications. They understand what their limitations are. And, that makes them obviously live a more rounded and full life.
So the inhaler is just there in case of an attack. Meanwhile, the medication is what helps you prevent it.
So there are different types of inhalers, actually. So you've got the short acting inhalers that are there for you to use whenever you feel like you're about to have an attack, or the symptoms are getting more severe. They give a basic short-term relief and help you feel better. And you can use that as frequently as you may need to. But then there are all the other inhalers that tend to contain steroids as well. And what these inhalers do, we call them the preventers. They sort of prevent asthma attacks, or more and more asthma attacks, right? So you have to take them. Usually, would take them regularly, so that the likelihood of you developing an attack is less and less as you go along. Yes.
All right then. Now there are some people who have said that you can resolve asthma. You can, in fact, fully cure it with some home remedies. Is it possible? So if you mix some sort of eucalyptus oil inside the boiling water and all of that, is it possible that we have
steam inhalation helps naturally to clear the airways, right? It's just like you're melting the mucus in the airways, or excessive production of mucus in the airways. It might give some relief, but it's only temporary. In the case of asthma, it doesn't cure asthma, right? And there is no cure at the moment, right, for asthma, because it is a chronic condition. And if there's anyone that's saying anything like that, please please don't believe them, and get seen by the doctors in the hospital.
All right, then. You mentioned earlier, because one of the things we have heard many times about asthma is that those who have an asthma attack, or those who have asthma, should not exercise. But you already said that for some people, that is only that only applies to them, not everybody. Did I hear you
Right.
right
So
then?
yeah. So sometimes people say, oh, asthma. If you have an asthma attack, you shouldn't exercise. That is actually not true, right? Children that have asthma attacks can actually play with their friends. People that adults that have asthma can do exercise, right? But it's about understanding and knowing your limitations and using your medications, right? So for children, what we advise is before every activity or play, they need to take 2 puffs of their inhalers, right? So that opens up their airways in case there's any stress on or strain on their airways whilst they're exercising. Um, Obviously that gives them that cushion. And we also advocate for moderation, right? So if you've got a diagnosis of asthma, you should know your limitations. You should know when you kind of are feeling out of breath. They're obviously athletes. They have done really well, despite having a diagnosis of asthma. So it doesn't definitely limit you from exercising and
What will be a
sports.
final word, because we really need to jump out of this conversation now?
Yeah. So I think basically anyone that has symptoms, the chest tightness, cough, especially worse at night, a chest difficulty breathing, needs a diagnosis, right? So it's not something that you need to put off, however mild. So you need a diagnosis, and that diagnosis is often clinical. So it's important that you get to a hospital. You don't wait till it gets to a very, very bad state. And it's also important that after that it's not something that you say over my dead body, right? You accept it, and you understand your limitations, in that you understand that this is something that is part of your life, and you understand how you can deal with it and prevent yourself from any of those adverse effects.
I wish we had more time, but then if wishes were horses, I would have jumped on one right now, because we're out of time. But thank you so much for how you brought clarity to the topic. Maybe one of this is we have a second part of this conversation or something else related to respiratory conditions. On YouTube, Christian Kende says, thank you for that breakdown, Dr. Yusuf. I'm sorry I couldn't take messages and calls because we are out of time. But thank you,
Yeah,
Dr. Shittu. Thank you.
It's a pleasure. It's a pleasure.
Across all social media platforms, start with Instagram. You can follow them at Neo Childcare. And of course, you can follow Dr. Shittu at TY Shittu. Thank you, and thank you again. Please enjoy the rest of your morning. You can go back to sleep now.
All right,
Thank you very much.
All right,
bye.
Bye.
All right, Lagos, you know that in 3 minutes time, well, we will be having the kids come over, the energy. I am looking forward to it. Are you? Yes, you can join us on YouTube to do that. Watch them and look at their faces. This is Smooth 98.1.
Once upon a time in a land without hope, a story was told of a girl born to rule.
Thank you, YouTube. Thank you for everybody, or thank you to everybody who watched. Bye.